Following surgery, you will have a bandage on your knee. You will also have a cooling cuff around the knee, and you will have AV boots on your feet. Nursing and other staff will make regular observations of your temperature and pulse, and will monitor medication and pain control. You may receive anti-inflammatory drugs and pain relief as appropriate.
Generally speaking, it's not particularly painful when you wake up because we take great measures to actually effectively block the knee with local anaesthetic during the procedure. The patient has a big bandage around their leg and immediately starts working with the physios in terms of activating the muscles, the quadriceps, which is the main muscle that we need to start firing up, and they start to move the knee. And most of the work is then done the following day in terms of getting the knee out straight, starting to bend it. We like to see patients get to 90 degrees before they're discharged, if possible, and they're comfortable. And at that point, we're happy for the patients to be discharged once the physios think they're safe enough.
Everybody's different. Every procedure is different, so therefore we have to take each case on an individual basis. So if it's right to get up for the patient and for the procedure, we'd do that.
After any kind of surgery, but particularly knee surgery, it's really important they get up and moving straight away. Often they'll be quite sore, and common sense would tell you if something hurts, don't do it. But we almost want to tell them the reverse and say, yes, it is sore, but you need to do it. You need to get up and get moving and do your exercises to get the flexibility back and start getting the strength and mobility back as quickly as you can.
After an ACL reconstruction, we're looking to see whether patients are comfortable following their surgery, whether the swelling is controlled enough that they can bend their knee, normally towards about 90 degrees, that the swelling and the pain is controlled enough that they have enough strength in their leg to be able to lift it on and off the bed, and that they can walk safely and comfortably. If the patient has stairs at home, we'll obviously practice those to make sure they can do those safely.
So, to recap, you'll be discharged home after your ACL surgery once you've achieved the following goals. You can straighten your leg equal to your non-operated leg. You can bend your operated knee to at least 90 degrees. You're able to lift your leg on your own when asked. You can walk safely with crutches and have practiced going up and down stairs with a physio. You understand the home instructions for the next week. And then the real work begins.
With an ACL reconstruction, we will book them into our ACL class, where they will go through a long programme of building up their strength and recovery, aiming to get back to the sports and activities that they want to recover to.
Find out more about the physio and exercise programme in the exercise playlists in this section of the website.